We'll start our class of anatomy by discussing chapter 1 that refers to the organization of the human body. A good understanding of anatomy and physiology is at the base of understanding all other medical sciences. So it is essential to have a good understanding of what normal body structures and functions are in order to be able to develop the ability to analyze the development of any other condition, anything that can go wrong and may affect the human organism. The human body has an amazing balance between all its systems, and each individual structure, as you will see, while we will discuss throughout this class different systems, different organs with their functions, each of those individual structures has a very well-defined function. Please take a moment to stop this presentation and review the learning objectives that are in front of us for this presentation. This is an overview of our class for today. We will look into body studies. We'll discuss what the sciences that relate to the body studies are, including anatomy, physiology, and pathology, and we'll define all these terms. We'll look into the organization of the human body, starting with the chemicals, and how this develops into more and more well-structured elements, ending up with an organism. And we'll discuss the systems. We have in our body 11 systems, and we'll look into a very interesting concept, which is the aging. We'll also discuss homeostasis, and we'll define this term with what is the negative feedback, what will be some barriers inside of our bodies, and how those barriers are defining and putting some kind of delimitations between different compartments in our body. And we'll discuss a little bit about gradients and resistance. We'll look into body directions. We'll define the directional terms and the planes in order for us to be able to have a common language and define all those elements in the same way. And as well, we'll look into and define the body cavities. We'll have two of them. We'll describe the dorsal cavity and the ventral one. We'll start by discussing the structure and function, and we'll need to define a few terms in order to have a common language and understand what we are talking about. So we can never discuss anatomy without looking into the physiology and the vice versa. They're interconnected. While anatomy looks more at the structure and is more descriptive, the physiology describes and defines the body functions. So let's go back to terminology. You will see that most of the terms that we use, they have their origins in Latin and Greek, because back in the day, many, many years ago, humankind started to be very curious about our bodies, how they function, and how they are structured. So let's go back to anatomy. If we split this word into its component parts, we can divide it into two parts. Ana, A-N-A, that means through or with the help of in Latin, while tomi means also in Latin cutting. So, in other words, anatomy means through cutting, or in other words that we can use in English is dissection. There is a reason for this name, because we were able to get insights and understand the human body structures by performing dissections. And obviously dissections can be performed by cutting means only, so that's how we ended up having the term anatomy. Let's look into the term physiology. So physiology also has its origin in the Latin language. You will see that everything that ends up with the suffix logi means the science of. So make a note to yourself. Logi suffix means study of. Physio means nature. In other words, physiology will be the nature, the science that will study the nature of our body, the body functions. Another term that I would like to define is the term pathology. Pathology studies is the science, again, the suffix logi. Pathology studies the diseases, has an insight into what's wrong. And you will see that we do have another term that it's a combination of physiology and pathology that is called physiology, which is the science that describes what mechanisms are compromised or what mechanisms are changed in order for a disease to develop. Again, pathology is the study of the disease. A lot of times, pathology will refer more to the changes in the structures or at the cell level, while pathophysiology will look into modification of the functions of the body that will generate a certain disease or condition. We'll move forward now and we'll describe levels of organization. So when we are looking out there and we try to understand living things, you will need to understand that any kind of living thing will be organized from a very simple and basic level to more and more complex. So the living matter will be made out of chemicals, most of the time being simple substances as water and salts, minerals, that will organize and will develop more complex materials such as sugars and fats and proteins, and we'll describe those in future lectures. All those chemicals, simple or complex, while they are organized together, they can form what is called the basic unit of all life, that is the cell. Some organisms are called unicellular because they are able to develop all the basic living functions in one cell. And an example of unicellular organism will be viruses or bacteria, or some of the molds are unicellular, and they perfectly are able to perform all the activities that a complex organized organism, including reproduction, is able to do with a multitude of cells just in one cell. For more complex organisms, the cells that look the same and perform the same function, they will organize themselves into what is called a structure that is called a tissue. More than one tissue that will serve the same purpose and will be able to put their functions together, each of those tissues performing individual and different functions, but together being able to serve a certain purpose, will organize themselves into what is called an organ. And as an example, you have in this image the stomach. And in the stomach, we do have the mucosa with different types of cell, not just one type of cell that will be able to start the process of digestion, the muscular level, the muscle, the smooth muscle layer of the stomach that will produce the movements of the stomach that will allow for the digestion and so forth. So you see how different types of tissues will, with their functions, will serve a certain purpose. Going further in the organization of the human body, organs that will be interconnected and again will have a bigger plan, will follow a bigger plan and serve a certain function in our body, will be organized in what is called a system. And an example is the stomach, that is part of the digestive system, together with the esophagus, small bowel, large bowel, and so forth. There are other organs also, and we'll describe the digestive system later. Human body is very complex. The way that it's organized is made up of 11 systems that put together and working smoothly and nicely together like a well-oiled mechanism will form what is called an organism. Because I was talking before about body systems, let's see how do we look at the body systems. And we have here a slide that is classifying them by their function. Body systems work together in order to allow the body to function as an individual system. However, we can look at them individually and understand how they perform individually, how do they cooperate to make the body exist and function as it is. If you look onto the slide, you will see that we have 3 of them that are considered protection, support, and movement parts of the body, and I will start with integumentary. The integumentary system got its name from the word integument, and integument means skin. We do have the skin with all its associated structures that becomes the outermost body system. Main function is to protect from injury and infection, serving other functions as well, and we'll describe them when we'll talk about individual systems. In the associated structures of the skin, we have the hair, nails, sweat glands, and sebaceous glands or the oil glands. We have the skeletal system that is it should be seen as the basic framework of the body, made out of over 200 bones. There are 206 bones, together with the joints that collectively are known as the skeleton. The third system that is part of the protection, support, and movement, and you can see why I say movement now, is the muscular system. Without the muscular system, the skeleton, that is just the framework, we're not going to be able to perform. We need the muscles that connect the bones and make the bones and the joints move. We have a second category of functions that will be coordination and control, and we have two systems under this category, the nervous system and the endocrine system. The nervous system will be made out of the brain, spinal cord, and all the nerves, both spinal nerves and cranial nerves. Together in the nervous system, we will include also the special sense organs as eyes, ears, taste buds, and the organ of smell, that they represent the receptors that will generate the senses, together with some other receptors that are present in the protection, support, and movement parts of our body, and even other systems that will be able to perceive pain and touch. The endocrine system is made out of so-called disconnected, scattered organs throughout our body. They are called endocrine glands. They are a similar function, and their function is to produce certain substances that are used by our body to regulate and control different functions. Very specific for the endocrine glands is that their secretion product, whatever they are producing, is eliminated directly into the blood and is not carried out through some tubes or channels. We have the circulation and immunity system that will include obviously the cardiovascular and lymphatic system. In the cardiovascular system, we will discuss the heart and the blood vessels, while in the lymphatic system, we'll discuss the lymphatic vessels or the associated lymphatic organs as the tonsils and the thymus, spleen, and the lymph nodes. Obviously, lymphatic system is considered circular. It has its role into the circulation and fluid management in our body. However, probably you know it's most famous for its immune role. We have another classification for our body system that will include the energy supply and fluid balance, and we have in that the respiratory system, digestive, and urinary. In the respiratory system, we'll discuss the lungs and all the passages that lead to and from the lungs. And at the level of the lungs, we'll discuss the physiology of the gas exchange, oxygen passing from the air into the blood and being carried to the tissues, while the carbon dioxide being exhaled or eliminated from the blood into the lungs and to the outside. The digestive system obviously is involving organs that are essentials in providing our body with nutrients and converting them from the form of food to those very basic matter structures as proteins and fats and sugars that the body is able to absorb. And the urinary system is the system that will help into elimination of most of the waste body and most of the waste products from our other physiological processes. The last category will be the production of offspring, that obviously in this group we will discuss the reproductive system. This will include the external sex organs and all related internal structures that are related and help into producing offspring. One thing is sure about every single one of us is the fact that we will age. And the effects of aging are those gradual changes that will occur in all body systems. Um, by saying that, it means that it's obviously that some of them are more visible. Let's say the hair color will change and our skin will wrinkle and will become less elastic and flexible. Um, However, our internal organs, the muscles, the joints, the lungs, the heart, the arteries, they all go through gradual processes of aging throughout our existence. Um, you can see here also named the decrease of the kidney function and loss of bone mass. All those will be discussed with each of the systems that we will discuss throughout the anatomy class. In each of the chapters, when we discuss a system, we'll have a certain part of the lecture will deal with the changes that are affecting that system by aging. So you have here a body system summary. You have this chart that is presenting the system, its components, and a quick few words that summarize the function of that system. Please take a moment to stop the presentation and review this. First question. Which is the most suitable field of study for an anatomist? Option A, the structure of the stomach. Option B, the mechanism of protein digestion. Or option C, stomach cancer. Or D, anabolic reactions. The answer is the most suitable field of study for an anatomist is the structure of the stomach. Option A. Option B, the mechanism of protein digestion cannot be an option while this is a mechanism. It's not a structure. Again, anatomy is dealing with structure and not with function. Physiology will deal with the function. B relates to the function. Option C, which is a stomach cancer, obviously it's a condition, is a disease. If you remember, pathology is dealing with that. While option D describes anabolic reactions, again, reactions are functions, relate to physiology and not anatomy. Question number 2. There are numerous levels of organization in the body. The correct order from simplest to most complex is option A, organ, tissue, cell, organism, system. Option B, cell, tissue, organ, system, organism. Option C, system, cell, organ, organism, tissue. Or option D, cell, system, tissue, organ, organism. The correct order from simplest to most complex is option B, cell, tissue, organ, system, organism. In order to be able to answer correctly this question, please take a look at your options. And you need to see that you need to find that option that starts with the simplest form. And if you remember, I was telling you that cell is the basic unit of any kind of organism, of any kind of living thing. So I have actually two options, option B and option D, that refers to cell. So from start, I will eliminate option A and C. I am left with B and D. And if I'm looking at B and D, I'm looking at the first option, it says cell. I'm looking at the last option, and both of them say organism, which is correct. That's the most complex organization. Now, I'm going to look into, because the last word cannot guide me in any way in order to eliminate one of those options. So I need to go into the second word, into the second from simplest to most complex option. And I see that for B is tissue, while for D is system. And I kind of know that system is something complex, so D should be eliminated, and I'm left with the option B. Question 3. Which system is composed of bones and joints? Option A, skeletal system. Option B, nervous system. Option C, immune system. And option D, muscular system. The system composed of bones and joints is obviously the skeletal system. Bones relates to skeletal to skeleton and not to the muscular. Obviously, option B and C will be eliminated. We'll define now the term homeostasis. Term homeostasis refers to the body's capacity of maintaining certain functions and certain elements related to the body function constant at all given moments. And I'm saying that because our body is exposed to environment, to the outside environment. And I'm not talking only about elements. I'm talking about several things that can happen around us. So despite any changes in the conditions in our outside environment, everything that it's not related to actual our body, all normal body functions will be maintained at that state of internal balance or constancy, if you want to call it like that. And this is what we call homeostasis. So in order to understand that, we need to define what can provoke any kind of changes in our internal homeostasis. And any condition that is subject to a change will be termed variable. In the body, those conditions, those certain conditions, will be described as regulated variable. And those will be kept on a very narrow range. And that's what we call the set point. And in a second, you will see, I will explain to you how that works. And it will be very easy for you to understand in a second. And I will just name a few of those that we have in our body. And we are not even aware that our body is making all those fine-tuning regulations all day long. And it doesn't matter if we are awake or sleeping. And those elements will be, one will be the body temperature, the volume and composition of the body fluids, the blood level of oxygen and carbon dioxide, and the blood pressure. All those are regulated variables. And regardless of what's going on around us, the body is keeping them at a narrow range or set point. Now, let's think about it a little bit. And I will try to explain to you how our body is able to perform that. So the homeostasis is maintained by our body using what is called a negative feedback. That's the main method. In the negative feedback, a control system based on information returning to a source. So you've been told since you were very young probably that everything that you do will have repercussion. In other words, we are used to get some kind of feedback based on our actions. And based on our actions and the feedback, we will regulate our behavior. I used to tell my youngest son that whenever he's doing something good, he will be prized for that. When he's doing something bad, there will be repercussions and some of his privileges will be taken away. So, in other words, I was using, in educating my son, what is called a negative feedback. Poor marks on a test or assignments should stimulate a student to work harder in order to perform better and pass the class. Otherwise, if they are doing again and again the same thing, performing bad, they will not going to pass the class. So the negative feedback, in summary, keeps all those regulated variables within the set normal range by changing them either upward or downward depending on the end result. In order to be able to have a negative feedback, we'll need to have a few elements. So the components of the negative feedback loop will be what is called a sensor. And the sensor will measure the level of the variable. We need to have a control center that is able to compare the measured levels to what is the set point. And we need to have an effector that will increase or decrease the activity in order to change the level of this regulated variable and bring it back to the set point. And definitely we'll have the pathways that will carry the information, those signals that will carry the information between those components. And you can see in a very basic way presented in this graph how the brain, which is the sensor, will feel the heat or the cold, and the body will respond by sweating or shivering in order to balance the temperature, either to lower the temperature or to increase the temperature, depending on the temperature on the outside. And this is the most basic way of explaining how we balance our body temperature. I will give you now another example in order for you to understand the negative feedback. And we will look at the thermostat. So most of us, we have a thermostat at home that we are trying to keep the temperature at a certain constant level and in balance. And if you're looking at that, we usually have what is called a set point that, let's say in our example here, it's extreme, it's between 66 and 70 Fahrenheit. So the sensor is perceiving the temperature. And whenever the temperature is lower than 66, it's too cold, right? The sensor will feel it and will alert the control center. The control center will open the circuit and will send an electric signal to the effector, which is the furnace. The furnace will turn on and the heat will be released in order to increase the temperature that was lower than 66. As a result of that, the temperature in the room will increase to our second set point, and our second set point will be 70. We don't want it higher than that. So the sensor will again feel the temperature, will alert the control center, that again will send an electric signal that will stop, will turn off the furnace, the effector. And as a result of that, the temperature will be, for a while, will be 70, and slower will start to decrease up to the point where the temperature will fall to up to 66 or lower than that, and then the sensor will be alerted again. Pretty much, if you want to look at our body, it functions just the same. The skin has the sensors that will feel the heat or the cold temperature. The control center is our brain, and the effectors are the muscles or the sweat glands, depending on if we need to lose heat or to gain heat. Talking about the set points, you can see here that our body temperature is set up in, and now you can see it in Celsius here. And I would like you to start becoming familiar with both Fahrenheit and Celsius, because US is the only place that still uses Fahrenheit. The rest of the world is using Celsius as a measure unit. So we have it. Our brain is set up to 36.5 up to 37.5 degrees Celsius. And you can see that over the time, everything that drops under 36.5 will be perceived by our body as cold, while everything that is over 37.5 will be perceived by our body as heat. And again, I'm talking about perception. We have sensors in our body that perceive it. It's the way that we feel it. It's not the absolute. We are not a thermometer to measure. So you can feel something as cold, while when you're measuring it, it may not be cold. It's just the way that you perceive it because it compares to the rest of the temperature of your body. Or again, if your body is very cold, you may perceive even a slight increase in the temperature, something that is not very hot, but that object's temperature is higher than yours, may be perceived as hot for you. So again, our body perceives things is not an absolute measurement unit. But in an ideal world, that's what the set point will be at the level of our brain, between 36.5 to 37.5. And you can see that throughout the day, our body warms itself and drops in temperature and warms itself again. And while warming itself, let's say when we are involved in physical activity or when we are in the process of digestion, that eliminates a lot of heat. Our body will start sweating. It can be perceived or not perceived. We do lose water through our skin throughout the day. Let's say when we are going to sleep and we are not moving, we are not into a lot of activities, our body cools down because I'm not having a lot of energy spent in my body. That's when our body will drop in temperature. And that happens throughout the day. Again, we can lose or gain heat or temperature just by being exposed to elements, being in front of a fan, and there will be those changes that our body will perceive. The same type of negative feedback can be applied to another system in our body. And we'll describe it again when we'll describe the endocrine system, but I want to introduce you to it and to see how the negative feedback can be applied on so many levels. And we'll start over here. You can see it where it says the challenge meal. We are ingesting a big hamburger. Once we eat the hamburger, what changes will be the blood glucose. The nutrients will be absorbed into the blood system and suddenly will be a huge increase in the blood glucose levels. And the regulated variable for now will not going to be the body temperature, will be the blood glucose level. Just because the blood glucose level increases and is now flowing into our blood will be perceived by the control center, or the sensor in this case, which is the pancreas. Pancreas is stimulated by high levels of glucose, and as a result of that, will secrete insulin. Insulin will help the body cells to get the glucose in. I would like very early in our anatomy class for you to understand that insulin is not acting on the glucose. Insulin is the mediator between the glucose and the cells. Insulin is helping the glucose, is the gatekeeper, is the gate opener for the glucose to penetrate the cells and allows the glucose to be used by the cells. So insulin will help the glucose to get into the cells, and as a result of the cells now using more glucose, because there is more insulin that opens the gates for the glucose inside the cells, the level of glucose will decrease and will decrease back to what is called the set point. And as a result of that, the end result will be that homeostasis was restored. Our body doesn't like very high levels of glucose or very low levels of glucose. And you can see that in the process of restoring the homeostasis, there is a decreased or deactivation of the pancreas secretion of insulin in order to stop and not produce a hypoglycemia, a level of glucose that is way too low for our body to be normal. Question number 4. Which of those examples will illustrate negative feedback? A. Decreased blood sugar stimulates release of a hormone that further decreases blood sugar. B. Decreased room temperature activates a thermostat, which further decreases heat output by a furnace. A rise in blood calcium levels stimulates release of a hormone that lowers blood calcium levels. Or D. A rise in estrogen levels stimulates production of a hormone that stimulates estrogen production. Before I'm going to analyze the answer of this question, I want to review with you very quick what are the main elements of the negative feedback. The negative feedback elements are that when one variable is increasing, there is something that will bring it back down. So I need to have opposite direction actions in the statement in order for that to be an element of negative feedback, and vice versa. If one variable is going down, I'll have the opposite action that will produce an increase in the level of that variable. So I cannot have in my sentence same direction action and variable changes. If something decreases, I cannot have an action that will continue to decrease that variable, or if a variable will increase, I cannot have an action that will continue to increase that variable. So hopefully this makes sense for you now and make you understand negative feedback needs to have opposite direction variable and action. This being said, let's analyze each of them, and we are looking at option A. It says decrease blood sugar, and the action will be a hormone that will decrease blood sugar. So I have same direction, action, and variable change. So I have a decrease with a decrease. So A is not an option. B, I see decreased room temperature will activate a thermostat that will decrease heat output. So again, I have same direction, change in the variable and action are in the same direction, decrease, decrease. So that's not an option as well. Now look at option C. It says a rise, which means increasing in blood calcium, will stimulate release of a hormone that will lower blood calcium. So an increase of a variable will produce an action that will decrease that variable. So this is a valid option. I will keep it in my mind. Always make sure that when you're answering multiple choice questions, you check all your options before choosing one, because a lot of times you will have to choose the most appropriate one. There will be more than one option that can be appropriate, but you need to choose the most appropriate one. So let's look at D now. A rise or increase in estrogen levels will stimulate production of hormone that stimulate, and means another increase in the estrogen production. So in this option, I have an increase will be followed by something that will stimulate and produce an increase in estrogen production. So D is not correct. Same direction, action, and variable change. So the only option that stays is the rise with a decrease, followed by the decrease in the lower in the blood calcium levels. Now that we understand that our body has a constant or almost constant, and with very narrow set points homeostasis, we understand now that we need to have some very strict barriers in order to maintain this very well regulated inside environment. So again, our body's ability to maintain homeostasis is dependent on those barriers, maintaining a separation between our almost constant internal environment and things that happens in our external environment. One of the examples will be the skin. So skin is very effective. It's a very good barrier that separates the outside and the inside. And we'll go into more in-depth when we'll describe the integumentary system in chapter 5. We also have other body structures, most of them looking like tubes. That will be the digestive tract, the airways, the reproductive tracts, the urinary tracts, that are considered coming in contact with the outside environment through certain areas. In those structures, we have a different type of barrier that it's a little bit thinner, it's moist, and it's called a mucous membrane. At a microscopic level, we see a different type of barrier that is called the plasma membrane that will separate between each of the cells that make up the tissues and what is called extracellular fluid. So what I would like you to imagine is the fact that those cells in different tissues, they come in contact, but they are not, in some tissues, they are more compact and more snug together, while in other tissues, they have some areas, the structure is a little bit looser and will have what is called extracellular fluids. In terms of composition, those two elements, those two spaces, intracellular space and extracellular space or fluid, they differ in types of their concentration of salts mainly. In terms of extracellular fluids, as an example, that can be the blood plasma, the lymph, the fluid that will be in between the cells in different tissues. We'll try and describe now a few more elements that relate to the homeostasis. So in order to maintain that balance between inside and the outside of the cell, we need to understand the elements that are, the terms that are flows, gradients, and resistance. A gradient is a difference in some very specific physical or chemical values between two areas, and this is called a gradient. And you can see in this image is this difference of height, let's say, that's a gradient. There can be an altitude gradient if it's the peak of a roof or an edge. Water from a snow melting on the steep roofs will flow, obviously, downwards following that gradient. Another term that we'll need to define is the resistance. And resistance is made up of all those factors that will inhibit or prevent a flow down a particular gradient. Let's think that the surface for the skateboarder is extremely smooth, ice smooth. The resistance will be minimal, correct? So that will not prevent, will not inhibit the flow down of the gradient. On the other hand, if that surface will be extremely rough, will have a lot of pebbles or a lot of stones or gravel on it, those elements will inhibit, will prevent the flow down the gradient. We'll describe now a little bit directional terms. And while we don't really have per se a terminology class that is completely separate from anatomy, terminology will be introduced, medical terminology will be introduced and discussed during all of our all of our lectures throughout this class. So we need to have a way to define and describe different regions in our body. And we need to have a certain consistency in describing the anatomic positions. More than that, we need to have a common terminology between medical professionals working throughout the world. And you will see that those directional terms and this medical terminology that you will learn now is used consistent worldwide. So let's start a little bit with directional terms. We define superior, everything that is above, we're in a higher position than a certain point. We'll say the head is superior to the shoulders. We always need, when we are giving directional terms, we need to give a reference. We cannot just say it's superior. Superior to what? Because the head will be superior to the shoulders, and the shoulders will be superior to the, let's say, to the knees. As opposite to superior, we have the term inferior that defines everything that is below or lower. Another term will be anterior or ventral. Anterior is located toward the belly surface or front of the body, while posterior will define everything that is closer to the spine or to the back of the body. We have another term that is called medial, and medial means nearer to that imaginary line that passing through the midline of the body. That line that will divide the body into right and left sides. So medial is closer to that, while lateral, it's its opposite, means further away from the midline. For example, nose is medial to the ears, or eyes are medial to the ears. Another term will be proximal. Proximal means nearer to the origin or to attachment point of a structure, while distal means further from that point. For example, the elbow is proximal to the fingers. It's closer to the attachment. It's closer to the attachment to the main trunk. In the same category, we'll discuss planes of division. And we describe three of them. We have what is called the frontal plane or coronal plane. So if any cut will be made in a line that goes down in the middle of the body, we'll have a ventral or a frontal section and a posterior or a dorsal section. So this is called the coronal plane. And this doesn't matter where it happens, how much in the front or how much in the back. It doesn't have to be symmetrical in the middle. It refers to the way that we are cutting the slices and we are looking inside the body. We have a sagittal plane, and the sagittal plane is if we were to cut the body in two from front to back, separating into right and left. Now, if it goes perfectly in the middle and separates into two perfect kind of opposite symmetrical right and left sides, it will be called mid-sagittal because it's literally in the midline, in the middle. If it's not over there, it's just the sagittal plane that can be more on the left or more on the right. And we have a transverse plane that is made when the cut is made horizontal and will divide the body into a superior or upper part and an inferior or lower part. And this is also called a horizontal plane. Again, if we have a cross section, this will be the horizontal or the transverse plane, the cross section. We have the longitudinal section or the coronal one. And in some options, we may have an oblique section. And all those lines and all those planes of division help us in imagistics. That's the medical field that will use those the most when we are performing CT scans or MRIs. And you have here an example, and I will show you what do you see over here. You have here a transverse or a horizontal section of the abdomen. You have in two different types of viewing them if we are changing the contrast. What you see here, very, very pale under, is the, and I will try and grab my, I'm trying to see, I'm trying to have my pen over here. Over here, this line that you see in here, this is the fat tissue. I will just remove it. Over here, this is a vertebra. All those lines over here, those are ribs. I'm sorry, I'm not making them very nice. This structure over here is the liver. The structure over here is the spleen. What you can see here is aorta, and you can actually have them named over here. Over here you see the cava, and you can see how aorta is running really, really tight on the body of the vertebrae. You can see here the stomach, and you can see it filled with what is called contrast medium. Obviously, the patient is sitting on their back. They are laying on the back, and this is the frontal side, and this is the dorsal, frontal or ventral, and this is the dorsal side. Question number 5, which term means closer to the body's midline? A, distal, B, lateral, C, medial, or D, transverse? The correct term is medial. As opposed to medial, further from the body's midline will be lateral. Distal is further from the attachment point, while transverse is a plane that divides the body horizontally. A plane that divides, question number 6, a plane that divides the body into anterior and posterior parts is the A, sagittal plane, B, proximal plane, C, frontal plane, or D, mid-sagittal plane. The plane that divides the body into anterior and posterior parts is called a frontal plane, if you remember, or coronal plane. We are moving now to discuss the major body cavities. And our body has two main cavities, a dorsal cavity, obviously closer to the dorsal side of our body or the back side of our body, and the ventral cavity or the frontal one that represents the front part of our body or closer to the belly. The dorsal cavity has two main subdivisions. We'll have the cranial cavity, that has inside the brain, and the spinal cavity that will enclose the spinal cord. And the ventral cavity has two main subdivisions that are separated by an actual separation plane that is the diaphragm, which is a muscle. We have the thoracic cavity in the upper part, and we have the abdominal cavity in the lower part. If you really pay attention to this, you see that the lower part is actually called abdominal pelvic cavity, having the abdominal cavity, everything that is in between the diaphragm and the outside part of the pelvis, and the pelvic cavity being that space, and those will include those organs that are hosted by the pelvic bones in the lower part of our body. There is no actual separation plane between the abdominal cavity and the pelvic cavity. They are one cavity, but we can subdivide it, and has implications in the way that organs will be exposed to trauma, or the way that we can examine different organs, or how diseases will spread inside the abdominal pelvic cavity. Inside the thoracic cavity, we have a few more subdivisions. If you look at the picture, you can observe that we have what is called the pericardial cavity that will engulf and enclose the heart, and it's situated in the middle and lower part of the thoracic cavity. We have two pleural cavities that will host the lungs, right and left side. And in the middle, we have another part that is called mediastinum that will have the great vessels. The abdominal pelvic cavity, again, is made out of the upper part, the abdominal cavity, and the pelvic cavity with their respective organs. We'll describe them a little bit more when we'll discuss different systems. In abdominal cavity, we'll have mainly the digestive system. Pelvic cavity will have mainly the reproductive system, while both of them will include parts of the urinary system. Now, when we are looking at the body and we need to describe different regions, or when we need to describe where a patient will complain about discomfort or pain, we split the anterior, the ventral side of the body into 9 regions. And we do that by drawing some imaginary lines. So we have 2 horizontal lines and 2 vertical lines. The vertical lines will go through the middle of the clavicle bones, and they will be pretty much very close and parallel to the nipples, while the horizontal lines, the superior one will go through the base of the ribs where the rib cage ends, while the inferior one will go through the what is called the superior anterior iliac spine. Those are bony prominences on both sides of the pelvic bones that can be felt in every single one of us. Even in overweight patients, those bony prominences can still be felt. So, and when we examine them, so it's easy to draw those imaginary lines. So if we are using those imaginary lines, we end up with 9 regions of the abdomen. We have a superior, a middle area, and an inferior area of the regions of the abdomen. For the superior one, we'll describe in the middle the epigastric area that will include the liver and the stomach, most of the stomach. We have the right hypochondriac area that will be the projection of the liver and the gallbladder. We'll have the left hypochondriac area where we'll have part of the stomach and mainly the projection of the spleen. For the middle part, we'll have in the middle the umbilical area where we have the projection of the small bowel. Most of the pain felt in this area is related to the small bowel. We have a right lumbar and the left lumbar areas where we have the ascending colon for the right side and descending colon for the left side. And for the lower part, we'll have in the middle the hypogastric area that will be the projection of the uterus in females and the urinary bladder for both genders. We'll have right iliac area that will be the projection mainly of the cecum and the appendix, and the left iliac that has the sigmoid colon. For the right iliac and left iliac, also those will be reprojections sometimes for the related pain in ovarian conditions in females. In a more simplified way of describing the abdomen, if we don't want to use the 9 areas and we want to really quick describe the presence of some pain, we can use just 2 lines, a vertical one and the horizontal one, that will cross one vertical and one horizontal through the umbilicus. That will leave us with 4 quadrants. We'll have the right upper quadrant, obviously for the upper and right side, left upper quadrant for the left and upper side. And you see that now the projection of the epigastric area and part of the umbilical will be transferred to the right and left sides, while the right lower and left lower quadrants will receive as well parts of the umbilical and the lumbar parts of the regions that we described before. Please take a moment and stop the presentation to look at this graph and familiarize yourself with body regions. We call cephalic, or the head area, the upper part of our body that will include the cranial side, where is the skull, and the facial or the face part. We call ocular everything that is related to the eye, oral, things that are related to the mouth. When we are moving down at the region of the torso, we'll call mammary region the breast area, axillary, everything related to the armpit. When we are looking at the upper extremity, brachial will relate to the arm, anti-brachial will relate to the forearm. Everything related to the wrist is called carpal, and parts related to the hand may be documented, or you can hear them named manual or palmar for the front part of the, for the ventral part of the palm. When we are moving down in the pelvic area, the groin area is called inguinal. The middle part in the lower abdomen is called pubic area. And when we are looking at the lower extremity, the thigh area is called femoral, with the leg area being called crural. The foot is called pedal. The area of the kneecap is called patellar. The ankle is called tarsal. And the phalangeal area, both in the hand and in the foot, relates to the fingers, respectively to the toes area. Same elements related to the posterior body region. When we are looking at the cephalic part of the body, we define as parietal, or the crown, the upper top of the head. Occipital is the base of the skull. The neck is called the cervical part. Parts of the shoulder can be defined as acromial or scapular, depending on if it's the upper part of the shoulder or the tip of the shoulder blade. The shoulder area can be called deltoid. The lower back is called lumbar. The area in between the buttocks, it's called sacral. The buttocks themselves are called the gluteal area. The back of the knee is called popliteal. The calf is called sural. The heel area is called calcaneal, while the sole of the foot, we call it plantar. Please go back and forth between those two slides and become familiar with the terminology. The best idea to become familiar with those is to make yourself some cards, some flashcards. Question number 7. Which organ is not in the abdominal pelvic cavity? And the options are A, gallbladder, B, liver, C, lung, or D, small intestine. The organ that is not situated in the abdominal pelvic cavity is obviously the lung, which is situated in the thoracic cavity. Which abdominal region is most inferior and medial? A, epigastric region, B, hypogastric region, C, inguinal region, or D, umbilical region? Again, which one is most inferior and medial? The most inferior and medial will be the hypogastric region. Now, when I'm looking for the answer, I will start by looking for, let's find the inferior one. Inferior means the lower one. So epigastric is superior, is up on top, it's under the rib cage. On the other hand, inguinal region, yes, is the groin area, so that will be inferior, that will be lower. Okay, I will keep it in mind. Hypogastric obviously is the pubic area, just above the pubic bone, so that's an option as well. And umbilical region, that's in the middle, so that's not an option. So I keep in mind B and C. Now, the next element in the question is asking me about medial. So I have inferior, now I need to find one that is not only inferior, but also medial. So hypogastric, yes, medial. Inguinal, inferior, however, lateral. It's on the sides. So inguinal will not going to be an option. So my only option that stays as viable is the hypogastric region. Question number 9. Which anatomic adjective describes the anterior thigh? A, crural, B, femoral, C, popliteal, and D, sural. The anatomic adjective that describes the anterior thigh will be femoral. As I said before, please get accustomed to the medical terminology. We will use it a lot, so it's good to make those flashcards and review it. The word part stasis is best defined as constant, downward, upward, or variable. Keep in mind that we use the word part, the suffix stasis, in homeostasis. So go with that term, think about it. So the word part stasis is best defined as a constant. If you remember, the homeostasis is that ability of the human body of maintain all the function as a constant or inside a very narrow range point. In medical terminology, most of the words will be formed by using either prefix with a root, suffix with a root, or you may have a combination of prefix, root, and suffix. Again, it's a good idea to have some flashcards. You will have materials uploaded in your OneNote class that will help you and give you some ideas of those examples so you can practice them. you can see here a combination of what parts, whenever you see a word part that is hyphenated at the end of it, that is called a prefix. If the hyphenation is the beginning, then it is called a suffix. So you see the element dis means apart or away from, like in dissection or cut off. Logi, meaning study of, as radiology, pathology. Path or patho means disease, or physio means physical or nature. Tomi means cutting or incision. Extra means outside of or beyond, as extracellular fluid, that it represents the fluid on the outside of the cells. Home or homeo means the same, as in homeostasis, that is that steady state that an organism likes to be. As opposed to extra, we have intra, that means within, as the intracellular fluid that is present inside the cells. Stat or stasis, that means consistency or a stand through, as in homeostasis.